We're sitting down today with doctor and healthcare administrator Danielle Martin, who also is the co-founder and board member of Canadian Doctors for Medicare. You founded, or you were part of the founding team for Canadian Doctors for Medicare. What prompted that decision?
So in 2006, we found ourselves in a situation in Canadian medicine where it felt as though there was a growing pro-privatization movement among Canadian physicians and actually among the general public as well. The Supreme Court decision in Shauli had just come down the prior year, which suggested that there was a move towards privatization in Quebec, and a very pro-privatization physician had been elected to the presidency of the Canadian Medical Association. And from reading the news coverage and sort of listening to the chatter, we felt that it was there was a general perception among the Canadian public that doctors had sort of given up on Medicare. You know, nice idea, too bad it didn't work out. Guess we're going to have to move towards a two-tier system. And we felt that that actually didn't represent the perspective of Canadian doctors, that in fact, just like the majority of Canadians, the majority of Canadian physicians really continued to believe in the values that underpin Medicare and wanted to see it improved. But they're too busy going to work every day to make that perspective heard. And so we felt there needed to be an organization to give voice to what we believed was really the silent majority of Canadian physicians who continued to support the principles of Medicare. And that was the impetus for the founding of Canadian Doctors for Medicare, which has actually proved to be a really successful organization in the Canadian health policy scene. And so I think we were right in that respect, that there was an unmet need for a voice on those issues.
And so the organization, one of the purposes is to sort of counteract what people think are to be the dangers of privatization and for-profit delivery and the two-tier system, correct? In your opinion, what are some of the misnomers of that people have, with regards to, two-tier system, that's great. What are people not understanding exactly?
I think that when you talk to Canadians who wonder about privatization as an answer to the Canadian healthcare system's challenges, most of those people have been fed a line on a couple of levels. The first is there's a belief out there that we could allow some people to jump the queue and pay privately for their care, and that would free up resources in the public system, thereby making wait times shorter for everybody else. In fact, the opposite is true. And has been shown to be true in international healthcare systems. We have a finite supply of doctors, nurses, OR time, administrative supports, technicians, machines in the Canadian healthcare system. And once you pull those resources out to service those who can pay, in fact, wait times are likely to get longer for everyone who remains in the public system. And so that doesn't mean that we shouldn't be addressing wait times or any of the other challenges in Canadian healthcare, but it does mean that this is unlikely to be the answer. And I think that that's the most important thing that Canadians need to sort of understand. The second reason I think that some people move towards supporting privatization is that they believe that they themselves personally would be likely to benefit. In fact, the number of Canadians, first of all, who could truly afford to pay for their own health care if they had encountered a significant health issue is incredibly small. It would put most of us, even higher income earners like myself and other physicians, in an untenable situation financially pretty quickly. And the number of things that can safely be done outside of public hospitals when you're seriously sick is very small. So we're really talking about a marginal number of people and a marginal number of issues, which at the end of the day is not likely to make any kind of dent in the challenges that we face. So at the end of the day, I believe, and I think most of my colleagues believe, that we're better off focusing our energies on improving the public system. That's what the vast majority of Canadians are going to use when they get sick. That's where the vast majority of Canadian doctors are going to continue to want to practice. And we all continue to support that fundamental principle that access to healthcare should be based on need rather than ability to pay. And that's really what drives and should drive the improvements that we're trying to make to the system.
You do acknowledge, however, that there are some challenges with the current system the way it is. What are some ways that we can perhaps improve upon them? Are there some innovations currently at work or in development or in thought process that you would be promoting or adopt?
The Canadian healthcare system faces lots of challenges, as do all healthcare systems. Every developed country in the world is grappling with the same issues. We have an aging population and a very hospital-centric system that is not likely to be able to respond to the needs of that aging population. We need much better community-based support, a lot better home care support, and stronger primary care support to deal with an aging population. We continue to struggle with wait times for elective procedures, specialist appointments. I think in general, most Canadians who interact with the healthcare system actually continue to rate it very highly. So once you get in the door, you tend to get really high quality care, and people tend to be very satisfied with the care that they received. But certainly we're struggling with those issues of waits in particular, and the need to kind of respond to the changing demographic. All of that actually is better addressed within the framework of a publicly funded system. Because what a publicly funded system allows us to do is to pay attention to issues of equity, make sure that care is there for people who need it, to triage cases where there are waits according to need, and then to work with new delivery models to try to reduce or address those challenges. So on wait times, for example, a huge amount of work is being done across the country to reduce wait times. We've been very successful in some areas, particularly around cataract surgery, hip and knee replacement surgery, cancer care, cardiac care. In almost every province, we've seen really dramatic results, but in other areas like diagnostic imaging, we haven't seen as great results. And it's interesting because we've been buying a lot more machines, but we, no matter how many machines we buy, we still seem to see the demand rise. And so that then starts to speak to questions of appropriateness, and are we really using the technology for those people for whom it's most likely to really make a difference. And these are the kinds of questions that people like myself as administrators in the system and physicians are trying to grapple with. How can we use the resources available to us to really benefit those patients who need it?
So ongoing work still needs to be done.
There's always going to be work to be done.
Okay. And more research is being made right now?
There are tons of innovative projects going on all over the country every day. In this very hospital where we sit, we're evaluating new models of care to improve access for patients, to try to keep them out of the hospital, to give them the care that they need closer to home. There are huge amounts of energy being poured into reducing wait times for specialty care. And a lot of that is less about putting more resources in. Often it's not actually about more money. It's about reorganizing the resources that you have. Could you take this specialist and have them come to a family doctor's office for a half a day and answer all the questions about every patient who's got a problem with that body part? You could probably deal with 50 cases in a morning instead of referring each of those people one by one to that person's office. Could you do e-consultations? Could you do Skype consultations? What about telephone consultations? What about more education for family physicians so that the family doc can deal with more of these issues without requiring a referral? What about patient self-care and education? How can we use the internet to educate people better? So there are tons of solutions out there that are being implemented and evaluated. And then the real challenge is when we find the ones that are very successful, how do we scale them up across the system so that it's not just successful in one neighborhood or one hospital or one community? We've got great examples like that all over the place, but how do we make them accessible to all Canadians? And that is one of the big policy challenges in the Canadian context.
Just getting a sense about you too, personally, like what sort of prompted you to get so involved in this area? Where did this sort of affinity for Medicare and your strong-mindedness and steadfast resolve to really ensure its stayed strong in Canada and stayed here in Canada. Where did that come from?
A few places. I mean, for me, I actually entered medical school after I had started a career in healthcare policy. So I entered into medicine with an interest in the healthcare system. That was really, it was my passion for improvement of the healthcare system that drove me to pursue a career in medicine in the first place. I'm also a family doctor. I'm a practicing family doctor, and I think that those of us who work in primary care in Canada really see up close what works well about the system, which is lots of things, and also what's broken and what needs fixing. And when you deal with people in their totality and in the holistic way that primary care and family medicine do, and you get to know them over time, I think you develop a real passion for system improvement that will respond to people's humanity. And I think that's really, like, at the end of the day, that is the value that drives all of this, is responsiveness to human need. And so that passion for equity, I mean, it comes from my parents and my family background and my own personal values and beliefs, but it's also been really reinforced and underscored by my patients over the course of my medical career.
And just go back to Medicare for a second. The BC Court Challenge.
Mm-hmm.
How frustrating is that challenge, and where are we at now?
So the case before the courts in British Columbia has been delayed and delayed and delayed. Now I think at least until March of 2016, next year, and who knows, maybe even beyond that. It will be a very important case if and when it ever does go to trial, because if Brian Day is successful in striking down the protections of the public health care system, it will become, it will become legal in British Columbia for patients to purchase care and jump the queue, and for physicians to charge essentially whatever they want for the provision of their services. But B, it will set a precedent that will could potentially roll across the country. And so I think it's likely that, if and when it eventually gets rolling, this case will go to the Supreme Court of Canada. And ultimately, I think people need to understand that this is not, the government doesn't have to prove that our healthcare system is perfect. Of course our healthcare system is not perfect. Of course we have major challenges and problems that we need to address. The question is whether allowing a few wealthy Canadians to buy their way out of the system is going to address those challenges. And I think it's pretty clear that it won't. And so that, I think, is the central question in the court case in British Columbia. And at the end of the day, if Brian Day is successful and the protections of Medicare are knocked down in this case, there are a few patients who would benefit, no doubt, and a few doctors who would benefit quite a lot. And the rest of us will be no better off. So ultimately, those of us who believe in strengthening the system for everyone, not just a very small minority of the population, are going to be left with the same work still to do, which is to improve the public healthcare system as best we can, knowing that it will always be an incomplete project that requires enhancement.
There was a lot of praise for the way you spoke at the Senate subcommittee in the U.S. Is it one of your more proud moments, or what are your proudest moments, and what would you say about that?
I mean, it's interesting because that moment, yes, it's a proud moment for me, but I think it mostly became a proud moment in retrospect. I've been doing this work along with others, research, policy development, healthcare system improvement work, advocacy for a decade, and so I've given that talk and had that debate, I don't know if it's 1,000 times, but it might be 1,000 times, and the thing about, the interesting thing about the internet and social media is that you never know which moment is the one that's going to catch, right? And so that was the case for me in the US Senate thing. It wasn't that I wasn't proud of how it went. I thought it had gone well, but I've sat on lots of panels and I presented to not to the US Senate every day of the week, but nevertheless the content of that conversation, which is maybe why I was able to respond to the questions relatively quickly on my feet, because I've heard all that stuff before. I've responded to all those myths before. I know that evidence. And so what's interesting about the sort of 21st century world of advocacy is those proud moments almost get defined looking back on them.
Yeah.
And that was certainly the case for this one. I thought it had gone well, I went home, I continued about my life, and 24 hours later, you know, I'm trending on Facebook and Twitter and, you know, Yahoo and Google and whatever else, you know, and then it's over, right? And then it's just this massive amount of attention in a short period of time, and then it's gone. So yes, it was a proud moment. Mostly it was extraordinary to feel how proud Canadians were of me. Because by extent, I mean, it wasn't proud of me per se, I was a channel for their pride about Medicare. And that's really what it was. You know, it was a moment that people were able to kind of experience their pride in the values that underpin our healthcare system, and that is special.